HPV infection, they like to infect cells here, okay, called the cervix cells here, that can lead to cervical carcinoma. And you know what a pap smear is? Okay, you just go up here, you just scrape up part of this cervix, okay, and look at the cell. Normally you should not see any immune cell. If you see immune cell as part of the cervix, that suggests this could be an infection or could be something worse, like carcinoma or something like that. What is this structure called?
Vagina.
For the female?
Vagina.
This is your vagina, okay? This is a vagina. And you can see how it's had this rugae structure. So I guess it could be longer if you need to, okay, to accommodate. Now, the female urethra, which is this one right here, is very short relative to male urethra. But the female urethra is used exclusively for the urinary system, right? While the male urethra is used both as part of the urinary system and as part of the reproductive. Now you can see that here, there are three openings. You get your anus over here, you got your vagina orifice over here, and then you have your urethra. Okay. And above that, you have your clitoris, which just sits there. So, you know, as a girl, you are taught to clean from front to back, okay, so that if you have this thing is wet, you can bring it back. You do never clean from back to front because there's a lot of bacteria here, and by bringing up front, you can contaminate this area, for example. Then you can get your urinary tract infection that leads to inflammatory bowel disease. Okay? So in fact, what I'd like you to do, we can think of this. I'm going to do some graffiti here. This region here is known as the vestibule. The vestibule will have, up here will be the equivalent to homologous structures to the glands of the penis, will be considered as clitoris. It's also very highly, has a lot of nerve endings, so it's a very sensitive area. It's normally hidden by a hood, so you can't see it. Right? You have to protract the hood back to see it. Next to that would be your urethra. Then you have your vagina. You can't really see this, the anus on the other side. Okay, so it's pretty much like this. This right here is known as the labia or labium minora. It's the lip, if you will. It's the inner folding, is the inner one. Then you have your outer one, known as labia majora. Now, this one is where you might see the hair. This one you might not see the hair, and of course, that's the length. And sometime a little bit below, you can say, "Oh, honey, I like you pooch." The little pooch up here, the fat area. This is known as the mons pubis. Alright, that's the mons pubis that sits up there, and of course up here above the mons pubis is the pubis symphysis. Okay, so you can see that. So you can say, oh, you see this right here? That's the little pooch area. This right here is your pubis symphysis. And you can see that this right here will be your labia minora, and this is labia majora. And because this area right here, the blood vessel will come really close to the surface, right? And so what color would you expect it to see?
Red.
Red is, Sometimes overuse of this area could become like a lot of fat tissue, so you get a surgically remove that. So that's the clitoris, that's just the vagina's orifice. Now, virgin girls usually have a membrane known as the hymen that cover this, okay? That cover this. And usually after marriage, and in some countries, they consummate the relationship, can rupture the hymen, and then you start seeing bleeding, right? So you can show the sheet. Bloody sheet. Good. Not bloody sheet. I don't know. She's not really. You mean I paid for 10 cows and 20 pigs, and it's not rupture. It's already rupture. So that's mean that she's not a virgin anymore. In some countries, virginity is a very serious issue. You can actually sew this together. Yes. Oh yes, we sew together. It's worth 10 cows. All right. Any questions regarding the female